Hello, everyone. I'm Peter Crasto Donnelly. I'm with the Food Pantries for the Capital District. Joining me is Vanessa Ruiz. She's with the San Diego Food Bank. Um, Both of us, part of our world is working with the Oasis Insight platform. It's a client tracking database by Simon Solutions. Both of us have found that the database is absolutely wonderful. Vanessa, just some background to where she's from and why she's joining us. She's been with the San Diego Food Bank for 18 years. She started in 2003, where she started as a receptionist. She's been working her way up since then. Being a receptionist allowed her to connect with a lot of food pantries and everyone day to day, and then she's been slowly working her way up to managing quite a bit. Vanessa, what remind me, what are you in charge of over at the San Diego Food Bank?
Yeah, thank you, Peter. As VP of Programs and Operations, I essentially oversee all of the functions of bringing food into San Diego for the numerous families that we serve, as well as getting the food back out. So everything in between: operations, volunteers, food procurement, programs. So a large chunk.
Yeah, and you found that Oasis Insight, with everything that you do on the operational end, has been really key to kind of helping you get some of that, get the information that you need, and that's what you'll be talking to everyone about today. Is kind of why you guys have gone with Oasis and the benefits and advantages it has brought to your organization.
Yes, absolutely. Paperless is definitely the way to go, and Oasis, as you mentioned, is a great platform. I'm glad to hear you all are using it. I know that there are several food banks across the United States that are using it as well. And yeah, I would love to go into more details about why we chose Oasis. I think one thing to mention is that Oasis is a separate platform from what we use for internal inventory tracking. This Oasis system is just for client tracking. So I just want to make sure that I'm clear on the differences between the two as we get into Oasis and describe the benefits that we have on that front.
And just as a note for everyone, in case this is one of your first sessions you're joining, please feel free to use the chat feature to ask questions throughout the presentation. So, all right, with that, let's take it away.
All right. Well, thank you everyone again. I'm really excited to be presenting to you all the way from San Diego, California. As Peter mentioned, my presentation is focused on our path to paperless. Um, I will be focusing heavily on the Oasis software system, but hopefully staying at a high enough level to where folks understand the greater purpose at a 50,000 foot level of why we chose to go paperless to begin with. So before I get going on that, I would like to give you guys a little bit of a background on San Diego County. And I think it's important to know the scope of our population and our services to then better understand why it was so important for us to come up with a better model to be able to track the work that we were doing. So San Diego County has a population of over 3 million people. So that's more than 22 states. It's fairly large, 4,500 square miles. And here in San Diego, we partner with 500 nonprofit partners, of which 180 of those are direct distributions, where our food bank is taking the food directly to the sites and distributing the food. Oftentimes, it's our staff that are running the distribution, also using the Oasis software system. And in addition to San Diego County, we also service a sister county right to the east of us, which is Imperial. They have about 180,000 residents, but they are also the lowest income county in California. So those two counties are our service areas. We are around the border of Mexico and Arizona, and then to the west of us are the beautiful beaches. So that is our profile for service area. When we're looking at who is food insecure, We break it into two different sections. So overall, we have estimated that 443,000 people, and mind you, these are pre-COVID. We're still working heavily on the overall scope and what it looks like now. But pre-COVID, the population, 443,000 people were considered food insecure in San Diego. So that's 1 in 7. 141,000 of those individuals were children under the age of 18. At risk of food insecurity are folks who are food secure because they are receiving benefits like CalFresh, which is known as SNAP, across the states, WIC. And so if not for those two programs, 197,000 people would be deemed food insecure. So that's a total of 641,000 people. And that then lowers to 1 in 5 being either food secure or insecure with the assistance of those federal programs. So quite a lot of individuals in need of services here locally. I thought it would be important to also show how we have changed just over the last 14 months since COVID hit. We were in 2019 distributing about 34 million pounds of food to our 500 nonprofit partners. We were serving 370,000 people every month with a small staff of no more than 78 staff and 25,000 volunteers annually. We have 2 federal programs. We have other programs as well, but our 2 federal programs saw pretty significant increases. Prior to the pandemic, our senior program, which is the Commodity Supplemental Food Program, we were serving about 13,700 seniors each month. And through the Emergency Food Assistance Program, we were serving about 88,000 people each month. If you look over to what we are seeing now, I mean, it is a drastic increase. We're looking at between 34 now to 70 million in the last 14 months since COVID hit, from 370,000 to 600,000 people served monthly. We've added 8 temp agency contracted staff in addition to additional staff that are now permanent full-time. Our senior program increased to 15,000 each month, not because we didn't have the capacity to do more, but that program particularly caps us on how much we are able to add. And our emergency food assistance program caseload went from 88,000 people a month to 143,000 people a month. So huge increases since COVID. Again, had we not had a paperless system, I don't know how we would be able to, one, keep up with the increase, but also track and make some really quick decisions. So I'll talk a little bit more about that in the presentation. Other programs that we have here, CalFresh Outreach. Again, here in California, our SNAP program for food stamps is called CalFresh. So if you hear me say that, it's our internal California new name. We have our Diaper to Degree initiative, which includes San Diego County Diaper Bank. We are the regional diaper bank for our county. We have a Food for Kids backpack program for elementary school students. We have an on-the-go pantry program for middle and high school students. We have a college hunger relief program, which services every college and university here in San Diego County. Our Food to Nonprofits program serves 500 nonprofits. We bring in food from all across the state, outside of the state, to support all of our nonprofit partners who have food pantries and soup kitchens and residential facilities, senior facilities. Our neighborhood distribution and mobile pantries are our way to get food to areas that we are considered to either be food deserts or there are gaps of service in the county. Therefore, we bring out our own vehicle with our own driver, oftentimes our own staff and volunteers, and we are able to provide a wide assortment of food, including a lot of fresh produce and canned foods and frozen meats. We're also really big on nutrition and wellness. We have an individual that works with our organization who provides recipes, cooking demonstrations, online virtual classes, grocery store tours, teaching folks how to eat healthy, and quick tips such as shopping around the perimeter of the grocery store and less within the aisles where you are more likely to find the processed foods. So very, very big on nutrition and wellness. And then our two USDA government programs that I mentioned previously, our Emergency Food Assistance Program and our Commodity Supplemental Food Program for seniors. So all this to say, the big question is, why did we go paperless? Why should you go paperless? For us, it was pretty simple. There were a number of things that we were looking at. One, client dignity. The days of folks standing in long lines for hours on end just to hope to be able to get food are behind us. And we wanted to shorten those lines. We wanted the times to be faster. We wanted folks to go back to their daily lives, with their families, looking for jobs, doing whatever it was, school. And so client dignity was big for us. And Oasis was able to give us a lot of functions that really allowed us to preserve client dignity. Real-time reports. If you are a nonprofit and you are watching this, you probably fill out a number of reports or you request reports from some of your partners. We have 500 partners, and getting them all to submit monthly reports on statistics so that we can report back to our funders was always very difficult. And so having that sort of information at your fingertips was not only great for our program staff, but also our development team, who is constantly seeking for more funding opportunities so that we can expand our services. Opportunity to change the food distribution network. There are going to be some innovative things that I will share with you all that were what I call bonuses to moving to paperless. So it did more than just the client dignity and the real-time reporting and accessing grants. It really did shift how we communicate and how we interact with our clients for the better of for them and for us as well. Accessing grants is huge, and the system it has allowed us to reach up to $1.5 million in grants thus far. And I know that it's also supported our partners who are using the software to get grants locally as well. Better control of our inventory. I don't know how many of you have dealt with this, but some of our partners sometimes overorder or under order, and it's very difficult for our food bank vehicles to come back to our warehouse and bring more food back out when we have a very tight calendar for other distributions. And so knowing the numbers real time allows us to have better control of our inventory, therefore also making it more equitable across the county, so that we're not giving one organization too much food that they are then going to have to throw away or struggle to get out back to the community. Reduction in community surveys. Oh my goodness, we have so many partners and we love all of our partners, but we have a lot of requests for surveys and folks that want to come out to our food distributions and survey clients because they fit the demographics that they're looking for. By creating an intake form that asks information that is very basic, we have eliminated the need to do as many surveys as we used to in the past. And I'll touch more on that later on. Greater opportunities for partner collaboration. And again, just saving time on reports, time on looking for information, pulling data, Excel spreadsheets left and right. Those were the reasons that we decided we need to go paperless. So the first thing we needed to do was our research. Who do we go with? So we did our research. We looked at a number of different software companies and ultimately landed with Oasis Insight database. Oasis Insight for us has proven to be just great at customer service, super user-friendly. We were very cautious of the fact that many of our partners who would be using this software work with volunteers who are not necessarily tech savvy. So we wanted to make sure that we were working with a software that would be very easy for folks to transition over to. And we felt that Oasis did that. The easy reporting, the tracking of the demographic information that we were looking for, and the very high interest that this organization, this company had to continue to be innovative. I know that we've done a lot of custom orders with this company, and it's just always been really great to have that sort of relationship especially as you're transitioning from paper to paperless. So our implementation plan was pretty basic. These are just some quick 10 steps on what we did to move to our paperless program. We identified the reasons, which I went over with you all. We researched the right software, which was Oasis. We tested this idea with our partners, their staff, their volunteers, to start dispelling some of the myths, because if we didn't do step 3 and just went straight into step 4 and started securing funding, however, none of our partners were going to be interested in this, it would have made it very difficult for us to move forward. So testing your idea out with your partners, letting them know that you're looking at a paperless software, you're looking for this to be across the board. That's really important, and it was a crucial step for us to talk about important things such as security. What happens if I share my information? What happens if I don't want to be included? How much is this going to cost my organization? Do I need to hire more staff? Will my volunteers know how to use the software program? So those were all, in Q&As that we had with many of our partners prior to even putting a budget together. Once we were comfortable with where we were at, we created a budget, and our goal was to get $1.5 million to bring all 500 of our eligible partners onto the Oasis paperless system. Now, mind you, for us, this included staff time, this included equipment. Some of our partners didn't need equipment because they already had their own laptops, but we wanted to make sure that we included everything. We went ahead, we purchased the equipment, we hired the staff, we created training materials in advance. We created messaging for the clients about why we were going from paper to paperless. We introduced it to our partners that were what I would call our low-hanging fruit. It was the go-getter partners who were interested from the very beginning on moving to paperless. And we started a rollout plan. Since then, it's been since end of 2015 that we've been rolling this out with our distribution sites, and we continue to review the program every single year just to make sure that we're still on track and that things are still going well. So those are quick 10 steps on what we did to go into it. So now I want to spend some time just talking about our journey through that process. And again, if you have any questions, feel free to drop it in the chat. I'm happy to answer them as we go. I'm also happy to share any of the materials that we created as we were moving along this journey. So messaging points, any of the intake forms that you see today, I'm happy to share all of that with you all. So we created a program called Feeding Everyone with Equity and Dignity. So our FEED program is the program that essentially moved us from paper to paperless. So far, we have brought on just under 150 partners, and it's been so amazing to see the bonuses that has come from moving to paperless. We have decreased wait times for our participants to 20 minutes or less. We have created an intake form that is the same across all of our partners, so that it is easy for clients to receive food from other locations without having to have an additional barrier of filling out paperwork everywhere they go. What I like to compare it to is locally we have a warehouse company, Costco. I think Costco is nationwide, but Costco, Sam's Club, you have your ID card and you can go to any Sam's Club, any Costco. Well, it's very similar with this system. Once you're enrolled into Oasis and you're at a food pantry that's using it, you can take that card to any other food pantry that has Oasis and you bypass that entire intake process. The data allows us to have improved equity, again, looking at inventory and looking at numbers and making sure we're not giving folks too much. Quick and efficient subsequent check-ins for registered participants. I mean, it goes by so quickly. You're scanning a barcode and then off they go getting their food needs and spending less time in line. And then obviously the time that our staff was spending reconciling records, all of that has gone away. So through our feed program, we have this intake form. It might be a little bit difficult to see, but I was trying to get it onto one screen. Again, you can put whatever you want on the intake form, and Oasis will customize it and make sure that there's a way for you to pull reports on each of these items. For us, we are using this intake form for both our government program, our emergency food assistance program, as well as for other information that we can use for grants. So the items that have an asterisk next to it, so name, date of birth, address, zip code, all of that is required. The remaining information is not. However, we explain to our clients that the more information they provide us, the more we're able to secure funding. But we do ask for other information such as their email, their phone number, how much they make per week, per month, gender, ethnicity, primary language, other questions such as, are you a veteran? We're in San Diego. It's a very high military town. Are you disabled, homeless, active duty, dependent? And then who is in your household, including the date of birth, so that we can track how many of our clients are under 18, older adults. That is all really great information for us to have and be able to, again, use for grant purposes. So once this information is collected from an individual, then it is inputted into Oasis, and it is now available on our network, therefore reducing the amount of double intakes that we have to do across the board. This is a picture out at one of our distribution sites. It shows mobilely kind of how we function with the Oasis system. So we have a Surface tablet, and connected to the Surface tablet, we have, it already has a battery, but we have an additional battery pack here. Over behind the tablet, we have a scanning gun that we use, and that's it. That's what we use to register our clients in and out of the system. So super user friendly and doesn't take up a lot of room. Again, you can use a laptop. If you're not working from outside, you can use a desktop computer. The system is cloud-based. So for us, it's very easy to use in all areas, whether we're outside or indoors. When we're talking about client dignity, this is the card that every client receives. Pictures are not required. In fact, when we first moved over to Oasis, I did say maybe we should forego, offering the option of pictures. Yeah, it's a little too invasive. And slowly but surely, folks wanted it. And it got so popular that we started bringing out these foam boards with, Hawaii backdrops, and folks were taking pictures behind it and really excited to have an ID card. For some, they said this was the only ID card with their photo on it. They didn't have the $25 to go pay for an identification at the DMV. And so it really, again, this was an additional bonus. Pay close attention to the barcode and also the color of this card. I'm going to talk about how we use this color. It's based on the individual's last name, but we use this for appointment setting. It's an option. It's not mandatory, but it comes automatically customized with the Oasis program. So when we go out to a distribution site, we're looking to, from beginning to end, where we distribute these intake forms, we collect them. So when we're originally moving from paper to paperless, we don't sit there and try to input 200 of these off the bat. It's very difficult. It's a lot of work. So our staff go out to our distribution partners, and we help over the course of oftentimes 3 distributions. So if they distribute daily, we go 3 times daily. If they're monthly, we go for 3 months. If they're weekly, we go for 3 weeks. And we help them by collecting the completed intake forms that are handwritten at first. And then we input them into the system with volunteers. And then we bring them the training materials. We bring the ready ID cards. We start handing those out to clients. And by the 3rd, 4th time that we come out, the number of new clients is very low. Therefore, it is now manageable to input all of the information directly into Oasis rather than completing a paper form. That has worked for us the best. But again, it does require, I'm not going to sit here and say it is the easiest thing to do. It will require additional volunteers, but with training, it can easily happen. And it's a very small price to pay for what you're going to get at the very end of this, which is full access to all data on who you are serving. So that's how our implementation flowchart works. And then here's some of the great things that we've been able to do with Oasis. So if it's not for our Oasis system, this is a picture of one of our drive-through distributions that we've done. And this happened because of COVID. Prior to COVID, folks parked and got out of their vehicles and stood 1 foot apart from each other and touched the same pen and signed for their food boxes on the Oasis system. And during COVID, that was not possible. So we wanted to make sure that we were helping folks remain safe. So we moved to drive-through distributions, and our tablets actually became mobile. So we wrapped them around ourselves. We had a nice little kind of belt that was customized for the tablets, and we just walked around with the tablets, and we were able to still enroll folks by scanning their ID cards. And rather than having them sign for their food on the tablet, we were able to create a barcode that automatically popped up this signature, I guess you can call it. During COVID, we were not requiring folks to sign their names. We were signing on their behalf using a barcode called COVID-19, and it allowed us to track that this person received food without them having to touch multiple pins or the screens or get too close to any of our volunteers. So safety was really important, and this made it very easy for us to do. Third-party barcodes, some folks either didn't care for the ID card that we provided or also wanted to connect their driver's license with their account. And so Oasis worked with us, and they were able to add third-party barcodes. Therefore, if an individual doesn't have a California driver's license or an ID or a passport, they literally can give us anything with a barcode, and we could connect that to their account. As long as they remember what they're giving us, we will connect them. And so these are examples of some of the third-party barcodes that we've used to help connect folks to their existing account. Barcodes are also used for the type of food packages that we're providing. So here are some examples of some of the barcodes that our partners are using. So one example would be if I, Vanessa, come up to a food distribution, the very first thing they will do is scan my ID card. That was the one that you saw with the picture on it and the green label on the top. So they scan me into the system that says Vanessa's here. Now what? Well, now we have to issue her some sort of assistance. So what did she get today? Well, she got a food package, so I would scan that. And then she also got toys for her children. So I'll scan that 2 times. And she got some diapers because she has a newborn at home. So they'll scan that once. Last barcode that you scan is to confirm. And then it would pop up that signature, which we would then automatically write right now as COVID. If it were not COVID, they would just sign with their finger, and that's it. All of this information is important because now at the end of the month, I can track how many people received a food package, how many people received toys, how many people got diapers. And I could do that at the click of a button. I could do it by day, by week, by month, by year, by location. Very, very simple. And barcodes, you can add as many as you want. We've pared it down so that there's no duplicates in the system when it comes to packages that we offer. But you can offer, if you do showers, if you do home cooked meals, all of that can be included. We've also started doing mass text. So you might recall that one of the questions that we ask on the intake form is, what is your phone number? If they provided us with their phone number, then we're able to mass text them. This is a picture of a food distribution, again, that we did during COVID, where we brought out a bunch of food and we broadcasted it on the radio, we broadcasted it on TV, but yet we still didn't have a lot of families show up. And unfortunately, we had ham, frozen ham at that. And so we thought, what do we do? We've already tried all of the media outlets. What do we do to get families to come and so that they know that we're here at this mall today? So what we did is we went into Oasis. We pulled a report on all of the people that were in the system in and around the zip code where this mall was located. And we mass text them the location, the time we were going to be there, and what we had. By 30 minutes after we sent that text, we already had a long line of folks coming through ready to pick up. So that, if that isn't enough of a reason to help move product faster and get the word out, I mean, I really don't know what is. This was really great for us. Similar to the mass text, we did broadcast. Broadcast allows us within an Oasis to do robocalls. So let's say your distribution normally happens on the fourth Thursday of every month, and this coming Thursday is Christmas or a holiday, or you all have to close for inventory. Whatever the reason is, you're able to do robocalls. You can create what the text is, and it will do voice to text, and it will call everyone that you tell it to call. Of course, there's data involved in data charges involved, but you can get packages, and it is so worth it. Especially again when we're talking client dignity, you're not having folks show up to your distributions, spending their last $5 just to find out that you were closed. So broadcast is really important. Kiosk mode is also available, and this is new through Oasis. By scanning the QR codes, now folks are able to register themselves. So, you guys saw the intake form. By scanning this, every question that you saw on that intake form is now available to them on their phones. So while they're standing in line waiting for food, they can go ahead and do this, or they can go up to someone with a computer and register them. So having both options, especially in today's day and age with technology being so high on everyone's radar, this is a really great option. It has definitely sped up intake on our end. So I did mention to you all the appointment option. This is something that we used to help with our partners who were seeing really long lines. Folks were showing up sometimes hours before their distribution started. And so the ID card that I showed you earlier was for Shelly Parks. Her last name is with a P. Her color was green. What this meant was that for this distribution particularly, they're open from 9:40 until 11, that this is the time period that the greens are able to come and get their food. This allowed for equitable distribution across all. And some say, well, my last name is with a Z and I'm coming at the beginning. Does this ever change? And the answer was yes. Sometimes what the agencies would do is the color stayed the same, but the appointment times would change every quarter. And so it would give folks an opportunity to come earlier, come later. Anytime someone missed their block, they had to wait for that color to finish, and then they could come in after that color was through. So again, this was really helpful for appointment setting, but you can only do this if you have everyone's name in the system, and then you're able to determine how to create these blocks for them. Partnerships I mentioned was really important. This is towards the end of my presentation here, but I wanted to touch on it because here locally we have an organization called 211 San Diego, and they have a community information exchange program where they link individuals who call 211 for support for other resources, and they link them to housing, education, healthcare, and food services. And so what was typically happening is someone would call and then they would refer out. But 211 never knew if that individual really reached that service. And so we have now integrated an open API, which is something that smart people smarter than me have figured out. And we've connected the two systems to offer all the way around referral services. And so now when someone calls 211 and they are referred to one of our distribution sites, as soon as they come to our distribution site, our system would kick back information to 211, letting them know the individual you referred to us came and got food. That's huge. That kind of closed loop referral system was huge for us, and we're still doing more of it, and we're learning all the benefits that come from this. But this is one example of how you can partner with other organizations and build open APIs between different softwares. So that is, kind of all the benefits that we saw by transferring from paper to paperless, using Oasis, all the benefits that have come from the system. It definitely has been an eye opener for us. We continue to learn so much more, as the years progress and as more and more partners are joining us. We even had a partner recently tell us, hey, did you know that instead of using a tablet, you can use your phone to scan people into the system? And I'm like, wow, we didn't know that you could do that. We hadn't tested phones. We were only testing laptops and desktops. And so, again, technology is definitely come a long way, and we are trying to take advantage of all of it. So thank you all for, listening to this session. Again, if you have any questions, I'm here to help answer those. And yeah, thank you again, and thank you, Peter, as well.
Yeah, thank you, Vanessa, for all that information. I know you and I have spoken a few different times, and every time I'm like, oh, she's mentioned something else that I didn't even think about, or like, oh, this is a really cool idea. We should look at that. Actually, I did have a couple of questions to run by you for the group here. For pantries that are worried about privacy and anonymity about their guests in Oasis, what would you say to them? And just a little background on that is that in our network, some of our users do work with an immigrant population. There have been, just concerns: who's going to have access to the data? Why should I share my information? What's good to know? So, what's your take on that?
Yeah, that's a really great question. We here at the San Diego Food Bank, our border town is Mexico, right? And it was something of a big concern for us, and we wanted to make sure that we were protecting all of our clients and that they felt safe. And so the very first thing that we did is we actually contacted Oasis and we asked, who owns the data? Do you own the data? Are you going to be sharing that data with anyone else? Or does the food bank own the data? Does the agency own the data? Their response is, we own the data. Therefore, the moment we decide we don't want to use it anymore, shut it off, cloud-based system, done. We also wanted to make sure our clients felt safe. So when we would talk to clients about registering, messaging was really important. We wanted to make sure that they understood that the reasons that we were moving to paperless was to help them. We said the very first thing was, yes, you're going to have to fill out this form. Think about it. You may never have to fill out this form again. You may never have to provide your address and your phone number unless things are changing, right? You won't have to do this, and you can go to other locations. Our goal is not to stop you from going to multiple locations. If that is what your family needs, that's not what this is for. This is just to be able to reduce the amount of intake that you have. But we did tell them, for those that said, okay, I like that, but I'm still looking to become a U.S. citizen, and I'm in that process, and I don't want anything to jeopardize that. What do I do? Do I not fill this out? I felt more comfortable when it was on paper. What we told them in the very beginning was, we don't even care for your real name at this point. John Doe, Mickey Mouse, I don't care what you put as your name. For us, it's to track the individuals so that we can better understand how many people our agencies are serving, how we can better serve you. Demographics, we did ask them to tell us what the real demographics were, but name really didn't matter. And when we told them we're not looking for social securities, we're not looking to verify against a photo ID, they became more relaxed. And they understood that this is actually to benefit them. I'm not sure if, Peter, you have this experience, but food pantries and food banks, we are held in high regard with our clients. We're not looked at like a government agency. There's less fear when an individual comes to a food pantry or a food bank. And so they really did trust that this information wasn't something that we were looking to gather to get anyone in trouble. It was to their benefit. So that's how we dealt with it here locally. And again, I'm happy to share some of the materials, the consents that we received from Oasis, and then also messaging that we used locally to help dispel that myth of using this information for the purpose of something else.
Yes, and what you'd said there, Vanessa, is very, very true. Pantry coordinators often form a really strong, and actually partners in general, form a really strong relationship with the folks that come to them, in need. And it was very important to be respectful of that. The goal here is I like that throughout your presentation, you've talked about the importance of dignity for the individual. And really the whole purpose of this is just to be able to go to the people who are providing funding for these programs and say, look, this is what's going on, and this is how you can support us to make the lives of the people we serve better.
Absolutely.
So,
absolutely.
So thank you. I have one other question for you. After Oasis, what do you think the next best step would be in technology to improve data collection around food scarcity?
So in technology per se, I mean, it is endless. Like I said, just in the last year, the QR code function, the ability to broadcast, through text and phone to all of our clients, that's all new stuff for us. Even though it's not new to technology, it's new for us because when you're serving 600,000 people a month, the idea of gathering phone numbers and contacting everyone, it just seems daunting. But when you can click on a button and say, I want the 92121 zip code, who attended the St. John's distribution on May 24th, I mean, it just makes things so much simpler, right? And so I think there's still more to learn. I think the open API network between different softwares is huge. Having different softwares talk to each other so that we can minimize not just what we're doing internally, again, trying to avoid the duplication within our network, but our partners too. So our food bank only focuses on food. We've started dabbling in diapers as well, but we don't do housing, we don't do employment assistance, we don't do healthcare. And so if we can start open APIs between those organizations to be able to share that again with the consent of our clients, that's a huge component of it. Then I think there's great opportunity there. On our end, there have been a lot of things that we still want to do with the data that we are collecting currently with Oasis. And one example is we had a couple of master level students come in and do their thesis, and we're looking at different parts of the data that we were collecting. And one thing they wanted to look at were trends. And so they started to pull data and they wanted to see, who is more likely to go to more than one or two distributions a month? How far are folks traveling to go to a food distribution? And when they were pulling this data and sharing it with us on GIS maps and what have you, we noticed things such as, folks were going from very far distances, 30, 40 miles to go to, some distribution sites in a central part of San Diego. As we dug deeper and deeper into why folks were seeming to go to this one location, when we would pull that pantry data, we said, I mean, what are you doing that no one else is doing, that folks are coming from 40, 50 miles? The average is 10 miles away. Sorry, it's not 10 miles. It was 3 to 4 miles away. But you're seeing 40, 50 miles away. What's going on? So we talked to that organization, and what was going on with that one particular site was that they serviced a high Muslim population. And whenever that organization received any sort of pork items through the food bank or through other donations, they were very cognizant and put that product separate from the rest of the food. And therefore, folks who did not want to take that, they felt that this organization was just, really believing in what, or at least respected their beliefs and allowed that product to be completely separate. That is information that we would not have known had we not seen that sort of trend. And therefore, then we shared that. We shared that with all other partners in and around that area and said, hey guys, how about when you guys get pork, how about you separate it out as well, so that these families can go to other locations and not just kind of bombard this one location for doing this. And those are, again, bonuses, but we're digging deeper to see how we can change the distribution network, how we can be more respectful of our clients, how we can improve the type of foods that we're providing. If you're looking at ethnicity, you might be able to tailor what you're bringing to a food distribution or a food pantry. So those are all, again, maybe not directly new technologies, but a result of what we could still be doing with the technology and the data that we're currently collecting that we have yet to really dig into.
See, it's amazing. I ask you one question. There's so many different directions that it can go, because it sounds like Oasis, what's great, I agree as well with Simon Solutions, is that they are innovating. Having APIs, I feel like the word, I hear it more and more often. For those out there not familiar, the idea behind an API is that if information is in one database, it is automatically sent over to another database. So that way the same information doesn't have to be captured twice. Our food pantries, Food Connect map is an example of that. And out in your area, your connection with your local 211 is another example of that. I got that right, correct, Vanessa?
Yeah, that's absolutely right. And it started for us just very simple, you know, a referral from 211 over. Now 211 is able to essentially give us all the data that we need to create that ID card, because they're essentially in the system now. We can mail that ID card out to the client, and now they don't have to wait in line to register. They can stand in the line that's ready to pick up food because they receive their card in the mail just from the questions that 211 asked them to get all these other services.
How wonderful that is. How wonderful that is. Like 211 can be kind of like a point of contact to get multiple things, but someone's just automatically getting an ID card and like, here you go, take this, go, and here's the pantries, go get some food.
Right.
So
yeah, it takes away the frustration, but also the anxiety. A lot of folks, I'm sure you're seeing this as well, it's their first time coming to food pantries, and they don't know what to do. It's it's the pride, and there's just so much going on. And so to tell them that you can bypass registration because we just did it over the phone and we're mailing you your card, and when you get there, you just get in line with everyone else. It goes a long way. It definitely has helped with our clientele.
So that's so wonderful to hear. Vanessa, we're coming to the end of our session here. Is there any last or closing thoughts that you'd like to make and share with the group?
Yeah, no, just thank you all for having me from way over here in San Diego. I have a lot of information, and I know I shared a lot today. But if you need any of the data pieces, again, I'm very happy to share those with you all as well. So thank you, Peter. This was a lot of fun, and I hope folks learned something today through our paperless journey.
Thank you so much, Vanessa. You have a wonderful time. Thanks for joining us.
Thank you.